Good morning, everyone. Today I decided to show you some external releases for the pelvic floor, specifically for the superficial muscular layer of the pelvic floor. So we're going to go ahead and get started. So this here is a female pelvis. So you can see that it has female anatomy. The muscles are the same for men and women. Obviously, men don't have a vagina, but these muscles are going to be in the same spot. So men can do this as well as women. So I usually start when I'm teaching this to my clients in person is to learn the bony landmarks because that's going to help us find the muscles. So right here we have the pubic symphysis. So this bone right here is referred to as the pubic bone. So you can see how there's some cartilage in between the two bones that creates some cushion. And you can see how this bone goes from up here all the way down here. Pubic bone, this is the bottom of the pubic bone. So usually what I tell people is when you're looking for this bony landmark, let's say I'm just going to stay on this side, you're going to find kind of your lower abdomen and kind of use your fingers. You can also use the base of your palm until you find kind of that top edge. But if you're all the way up there, then you're not necessarily going to be as close to the muscle as you can be. So we're going to find kind of where that bone starts to wrap around, and that's going to kind of be where we're going. If you're here, that's okay. So pubic bone, we have pubic bone on both sides. The next landmark we're going to find is the ischiotuberosity, which is sometimes also referred to as your sit bones. So that is this part of tuberosity. So it's the same bone. So you have two of these big iliac bones, but these different areas have different names. It doesn't matter. We're going to find your ischiotuberosity. If you're sitting on your butt, you're going to kind of feel a hard bone, rotate their thigh in and out, and you can kind of feel where that bone is attaching leg. And the last landmark we're going to find is not a bone. It's more like a tendon. It's called your central tendon. So we're really looking for your perineal body. So that's going to be the area between your vaginal opening and your anus if you're a female, or kind of between the base of your penis and your anus if you're a male. There's only one of these, and this was not going to feel hard. This is going to feel more similar to the tip of your nose. If you go ahead and touch the tip of your nose. So it's firm, but it's not hard the way your pubic bone or your ischiotuberosity is hard. So you can see how in this anatomical model, there are three muscles that we're going to target. There's one on each side. And then we have this one and this one. So you can really see the muscle more on this side because this is a gland. So there's only three muscles, but you have one on each side. So total of 6 muscles that you can practice this on. So what we're going to do, and I usually recommend sitting or laying on your back with your knees wide and your feet together in like a butterfly position, and then propping yourself up on a couple of pillows so that you don't have to crunch to reach. If you're sitting completely on your pelvis, then it's going to be really hard to get to some of these landmarks. So laying down, propped up on a few pillows, and you're welcome to wear gloves if you have gloves. If not, make sure your hands are clean and make sure your nails are short so that you don't hurt yourself. So we're going to start with the first muscle, which is called your ischiocavernosus. We're going to find the pubic bone, and then we're going to find the sit bone. So you can see how this muscle is slightly at an angle. You're going to apply firm pressure on the bony landmarks, and then you're going to spread the fingers apart to stretch the muscle. Now, if that feels uncomfortable, you can also, with firm pressure, push the fingers towards each other to shorten the muscle. That's a counter strain technique, more of an indirect stretch. Both are targeting to lengthen the muscle. So obviously, because this is an anatomical model, it's not going to stretch or shorten. Some people feel a stretching sensation. Some people feel like a tearing sensation. Some people might even feel twitching. If you were going to find the same muscle on the other side, you'll bring your finger over to the other side on the pubic bone and then the ischial tuberosity on the other side. And again, you can either apply a direct stretch by spreading the fingers apart, or you can press the fingers towards each other to shorten the muscle, to take tension out of the muscle. For the next muscle, we're going to stay on that pubic bone, but now we're going to find that perineal body. So I usually like to pin the perineal body because it's a lot less space with a finger, and then pull up using the top hand. So this muscle, I'm going to turn it a little bit, is a lot more vertical compared to the last one. Again, you can apply a direct stretch by bringing the fingers apart. So just make sure your fingers aren't sliding on the skin. So firm pressure, enough pressure to keep the fingers where they are. And then you have the option of shortening and bringing the fingers together to shorten that muscle if the direct stretch is a little uncomfortable. On the other side, same muscle, come to the other pubic bone. You can leave your finger on that perineal body because there's only one. And then again, you're going to stretch straight up and down or scrunch the muscle. And the last muscle we're going to find is horizontal. So this is the superficial transverse perineal muscle. This muscle that's vertically up and down is called the Bulbocavernosus in females and the Bulbospongiosus in males. So to find this final muscle, the superficial transverse perineal muscle, which goes across horizontally, we're going to find that sit bone, so your ischial tuberosity, and then you're going to use a finger, place it on your perineal body. Again, I like to pin this area because it's pretty small, and then pull out using the outer finger for a direct stretch, or you can kind of scrunch the muscle to take strain out of the muscle. On the other side, I'm going to switch and use my thumb to keep on the perineal body, and then I'm going to use my other thumb on the other side to stretch this muscle or scrunch this muscle. So when you're doing this to yourself, there's a lot of factors that play into which finger, which hand you're going to use. There is no right or wrong, but we're going to be using the pads of our fingertips. So if you need to use one hand and maybe an index finger or a thumb, or play around with switching your thumbs and index fingers or switching the position of your hands to find something that's comfortable in, then go ahead and do that. I usually recommend holding the stretch for at least 90 seconds. You're welcome to hold it longer if you need to. And like I said, the direct stretch is usually a little bit more intense. So if for some reason there's one muscle or one side of your pelvic floor that feels more uncomfortable, feel free to work on the indirect stretch or that scrunching counter strain technique. All right, let me know if you have questions. Good luck.